Welcome, and thank you for tuning in to the second video of the series. To recap, in the last video, we discussed the risk of developing depression as a grandparent caregiver. We defined depression, looked at its signs and symptoms, and explored resources inside and outside of Texas GRG. If you haven't watched the first video, please go and watch that to learn more about the coalition and the purpose of this video series. This video, we will discuss how to occupy yourself to prevent depression. In order to do that, we must first understand what occupations are. In the context of this video, I'm not referring to occupations as your job or what you do for a living. Those are vocations. But instead, occupations are everyday activities that we engage in to occupy our minds and our bodies. In the description below, I have also included a link to the Occupational Therapy Practice Framework, or OTPF. This framework acts as a Bible that guides the occupational therapy profession and how occupational therapists practice. Per this framework, there are subgroups of occupations. There are activities of daily living, or ADLs, and instrumental activities of daily living, or IADLs. ADLs refer to activities that you engage in to take care of yourself. They're usually done based on routine. Some examples of ADLs include showering, personal hygiene, getting dressed, and eating. IADLs refer to activities performed that contribute to life at home or within a community. And IADLs examples include driving, home management, and preparing meals. This section of the framework might help you to brainstorm for the next part. Review these categories of occupations if you're having a hard time thinking of some on your own. You can use the template provided in the description, or you can write it down on your own, however you would like. Think of occupations that you have considered important. Break down these occupations into past ones that you're currently engaging in, and those that you might or would want to engage in the future. For example, some occupations that I have previously or am currently engaging in are caring for my pets, religious expression, rest and sleep, and education. At this time, you can pause the video to write down what past, present, and future occupations you have or want to engage in, and press play when you're ready to continue. Now that you have these meaningful occupations, I want you to specifically identify which ones are important to you right now. What occupations bring meaning to your life? For example, for me, occupations that are currently meaningful or that I'm currently engaging in include caring for my dogs, religious expression, health management, rest and sleep, education, and social participation. Engaging in meaningful occupations can be therapeutic. By focusing on what is important to you, you can use these meaningful occupations to improve your mental health. So using my list of meaningful occupations that I just gave a little bit ago, this is how I'm currently implementing them into my daily routine. I schedule set times aside to feed and play with my dogs, to make sure that they're properly being taken care of. With religious expression, I listen to a podcast for reading the Bible in the mornings, and I attend church on Sundays. I'm still improving on setting time aside to relax and rest and make sure that I'm getting enough sleep. I'm currently in school pursuing my doctorate degree in occupational therapy because I want to further my education, and it is important to me. I value the balance between work and social life, so I account for time with my family and friends. Just like I shared how I incorporate occupations into my life, I want you to start thinking of some ways you can implement occupations that hold importance to you and how they can help you combat feelings of depression. In the next video, we will dive deeper into what occupies your day. We will look at specific activities and how they impact your mood. Thank you for watching, and we'll see you in video 3.